People always say, just lose a little weight and it'll help your health a lot. Well, logically, it seems that losing a little weight will only help a little. What's the deal with that? Well, with 2/3 of Americans bulging into the overweight and obese category, it's no wonder that losing weight or starting an exercise program consistently ranks as the top New Year's resolution, but by now you have had some problems keeping that resolution out there. The National Institutes of Health estimates that more than 172,000 premature deaths each year are directly attributed to obesity, the major due to cardiovascular disease. But did you know that even a modest 5% decrease in weight can significantly improve your health? When you step on the scale day after day and don't see any improvements in your weight loss efforts, you get frustrated. Suddenly losing that extra 5, 10, or 50, or even 100 pounds seems like an impossible feat. However, by changing your focus, you can change your mindset. Focus instead on the health benefits of shedding that excess baggage. Stop making weight loss all about your pant size and make it about living longer and living healthier. New research has indicated that even a small weight loss can result in enormous gains and potentially life-saving changes. You can reduce your risk of heart attack, cancer, stroke, dementia, and more by just losing 10 pounds or 5 to 10% of your body weight. I'm going to give you the skinny on the specific benefits so you can get started today. Losing weight will lower your cholesterol level. Being overweight is linked to high levels of LDL. As LDL cholesterol circulates through your blood, it can deposit plaque in your arteries, narrowing them, which can lead to a heart attack or stroke. Losing 10 pounds will lower your blood pressure and therefore will protect your heart and kidneys. High blood pressure is twice as common in adults who are obese. In the United States, everyone has a family member that's on high blood pressure medicine. We know that high blood pressure causes strokes, so as a community, we have got to lose this weight. Put down the Philly cheesesteaks. You can have one, just not one every day. Losing 10 pounds reduces risk for heart attacks and heart disease, which includes heart attack, congestive heart failure, sudden cardiac death, angina, and abnormal heart rhythm. These diseases occur more often in individuals who are overweight or obese. Incredibly, just 10 pounds of weight loss can result in a greater than 50% risk reduction for heart attacks. When you lose 10 pounds, it reduces your risk for dementia. Nearly half of Americans have too much visceral fat, the abdominal fat that surrounds your internal organs, visible in their protruding bellies. Visceral fat contains cells that release inflammation-causing chemicals in the body, which can cause memory loss and increase your chances of developing dementia. Losing 10 pounds reduces risk for sleep apnea. When you're overweight, extra tissue thickens your windpipe wall, narrowing your airway. Unsuccessful efforts to take in air while sleeping leads to sleep apnea. When you lose 10 pounds, you reduce joint pain because being overweight puts huge pressure on your joints. For each extra pound of excess weight on your body, you add 3 times that amount of pressure on your knees and 7 times that amount of pressure when walking up the stairs. This means that 10 extra pounds equates to 30 pounds of pressure grinding down and 70 pounds going up the stairs. Over time, this force wears away your cartilage, leaving an area of arthritis. For every 2-pound increase in your weight, the risk for developing arthritis increases by 9 to 13%. When you lose 10 pounds, you reduce your cancer risk. Obesity increases cancer risk, especially colon and breast cancer. The exact reasoning remains unclear, but fat cells are highly active, releasing large amounts of hormones like estrogen, insulin, and insulin-like growth factors that can fuel many cancers. You will also have a reduced risk for diabetes by losing 10 pounds. The more excess body weight you have, the less sensitive your cells become to insulin. More than 80% of people with type 2 diabetes are overweight or obese. A weight loss of 10 pounds can reduce your chance of getting diabetes by 60%. And some think the best reason to lose 10 pounds is that many studies show you have a much better sex life if you lose the weight. What could be a better reason? So let's just get it in gear and make sure you lose this weight to make you happier and healthier. I'm your favorite doctor, Dr. Corey Hebert for BlackHealthTV.com.